My name's David Farden and my job title is Mental Health Nurse. I work for the South Hams and West Devon Perinatal Mental Health Team. I've worked in a lot of different areas of mental health throughout my career, but I thought that perinatal mental health was an area in which I could make a really good contribution. It encompasses families, mums, dads, babies, but also it looks at child development and parent-infant relationships, which I found to be really interesting because it was a new learning opportunity and not an area I touched on before in my previous mental health work. It's been particularly interesting being a man coming into it and offering a male perspective, because it tends to be an area where it's quite female dominated in terms of staff, and I think it would be great to have more men coming in, and the responses I've had have been really positive from mums and dads and children to my contribution. I'll go and see people at home and people will have individual care plans, and some people are having wellbeing birth planning. Quite often we're working on those things in the antenatal period. And then sometimes postnatally we're looking at helping people with postnatal depression, helping people with anxiety and cope with the huge adjustment of having a baby. And sometimes we're referring people for birth trauma and those kind of psychological services that people sometimes need. With perinatal, it's almost like the ultimate early intervention, because it's not just about mum and dad, it is very much about the child, and you're really thinking about child development from a very, very early stage. So if we can help people get things right and help children get what they need, then that will improve long-term outcomes. And the most rewarding part of my role is building therapeutic relationships through a combination of your own interpersonal skills and your own ability to be warm and to listen, but also a sense in which you understand the system and you help them get what they need, and knowing who are the other people and the other support services which you need to access to help them. So yeah, I find it really rewarding. I have got a really supportive team, colleagues who are mental health nurses, psychologists, peer support workers and doctors, and it's a really nice multidisciplinary team to be part of. It feels very inclusive, and when the decisions are made they tend to be team decisions, and there's some quite difficult things can happen in perinatal, and you quite often need a level of support, and I find it is a very supportive team to work with. My experience of working in Devon is working in a very large, quite spread out rural patch, and you have to think creatively about what's available locally, and you have to develop a good knowledge of the local services. And often when you speak to the right people, there is a lot available for people locally. So it's about understanding those networks and tapping into them. You are in a very therapeutic environment. You are driving through the beautiful parts of countryside that people would probably go to on the best day of their holiday, going to the beach regularly, enjoying the great outdoors. It's all there on your doorstep. It's good for your own mental health. I've been given a lot of autonomy, which I really like. So it's very much up to me how I structure my time, and I found that really, really liberating. I would definitely recommend working for Devon Partnership Trust and for Perinatal. There's a lot of resources, and it's rewarding to be able to give people a really good standard of care and really help them to get the help that they need in a timely way.